Picture this: you're sitting in a doctor's office, frustrated and exhausted. You've been feeling off for months, sweaty at night, tired during the day, maybe even packing on some extra weight. You've heard it all before. Oh, it's just menopause. But what if it's not just menopause? What if there's something else at play, something that's throwing your body for a loop and is easy to overlook? The hidden link: thyroid issues and menopause. So, here's the deal. Menopause and thyroid issues have symptoms that are so similar, they often get mixed up. You're dealing with fatigue, mood swings, weight gain, maybe even changes in your skin or hair. Sound familiar? Both menopause and thyroid disorders can make you feel like you're on a wild roller coaster, but here's what most people don't realize: these two conditions might actually be connected. Think of the thyroid as the engine of your body. It produces hormones that affect almost every tissue and organ. And during menopause, you're already dealing with hormone changes, so if your thyroid decides to join the party, things can get even more complicated. Menopause and thyroid disorders, a double whammy. The thyroid is a small, butterfly-shaped gland in the front of your throat. When it's working well, you might not even notice it. But when it's not, it can throw off your entire system. Women are more likely to experience thyroid problems, especially as they age. Why? The main suspect here is estrogen, which is directly involved with thyroid function. Estrogen levels drop significantly during menopause, which can impact your thyroid hormones too. So, it's easy to see how some women end up with symptoms from both issues. Imagine running on a track but constantly feeling like you're stuck in slow motion. That's the impact of a sluggish thyroid, compounded by the hormonal shifts of menopause. Similar symptoms: menopause versus thyroid disorders. Now, let's dive into the nitty-gritty. If you're in perimenopause or menopause, you may experience symptoms like hot flashes, night sweats, mood swings, trouble sleeping. And guess what? If you have an underactive thyroid, or hypothyroidism, you could also experience fatigue, weight gain, cold intolerance, mood changes. It's almost like these symptoms are reading from the same script, right? That's why it can be so tricky to figure out what's really going on. But there are some clues. Women with hypothyroidism often report feeling cold when others don't, while menopause typically brings on hot flashes. The role of estrogen in thyroid function. A 2011 study found that estrogen could have a direct effect on thyroid cells. In the years leading up to menopause, as estrogen levels drop, your thyroid might slow down too. It's a domino effect that can leave you feeling out of balance. And yet, there's more to learn. Scientists are still researching exactly how these hormones interact. But the takeaway is clear: hormone shifts during menopause could impact your thyroid, adding another layer to what you're experiencing. Comparing menopause and thyroid symptoms. Here's a quick rundown to help you distinguish between menopause and an underactive thyroid. Menopause often comes with symptoms like hot flashes, night sweats, vaginal dryness, mood swings, and weight gain. In contrast, an underactive thyroid can cause cold intolerance, dry skin, constipation, moodiness or depression, and changes in weight. Timing is an important factor as well. Menopause typically occurs between the ages of 45 and 55, while thyroid problems can develop at any age. For many women, these two conditions may overlap, making it difficult to pinpoint which one is causing which symptoms. Hyperthyroidism, another consideration. While it's less common, some women also develop hyperthyroidism, or an overactive thyroid. This condition can lead to rapid weight loss, an enlarged thyroid gland, and bulging eyes. Hyperthyroidism can mimic menopause symptoms too, such as weight loss or mood swings. If you're experiencing these symptoms, it's worth asking your doctor to take a closer look. Why it matters: thyroid issues and menopausal complications. So why does all this matter? Thyroid problems can ramp up some of the risks already associated with menopause. Take osteoporosis, for example. During menopause, the risk for this bone-thinning disease goes up. If you have an overactive thyroid, your risk increases even more. The same goes for cardiovascular issues. Both thyroid problems and menopause can raise your heart disease risk. When these two conditions overlap, it's crucial to stay vigilant about your health. How to get answers, testing and diagnosis. If you're noticing symptoms and aren't sure if it's menopause or thyroid issues, you don't have to guess. A simple blood test can help you figure it out. Here are the common tests. Follicle-stimulating hormone, FSH, elevated levels often signal menopause. Luteinizing hormone, LH, persistently high after menopause. Thyroid-stimulating hormone, TSH, a high level could indicate an underactive thyroid. T3 and T4, these are the main thyroid hormones, and they're measured to check thyroid function. Thyroid antibody testing. If antibodies are present, it could mean Hashimoto's thyroiditis, a common cause of hypothyroidism. Your doctor can go over your symptoms, ask about your medical history, and help you figure out which tests are right for you. Soy in the thyroid, another consideration. Some women use soy supplements to help manage menopausal symptoms. But if you have borderline thyroid function, soy could actually interfere. Soy can impact the thyroid's ability to produce hormones, especially if you're not getting enough iodine. So if you're taking soy, make sure your diet includes iodine-rich foods like iodized salt. Staying healthy, the bigger picture. Taking control of your health means understanding the complex interaction between your thyroid and menopause. They can both increase the risk of things like osteoporosis, weight gain, and cardiovascular issues. Getting regular checkups, eating a balanced diet, and staying active can help keep your body strong. Calcium-rich foods and supplements can also be beneficial for bone health. Final thoughts: finding the right care. Don't settle for feeling off. If you suspect you're experiencing symptoms from either menopause or thyroid issues, or both, reach out to your healthcare provider. They can help you navigate these changes and create a plan that works for you. Finding a doctor who listens and takes the time to understand your unique situation is key. It might take some trial and error, but the peace of mind that comes from understanding your body is worth it. In the end, managing menopause and thyroid health is about feeling empowered to make the best choices for you. Understanding the connection between the two can be a game changer. So stay curious, ask questions, and don't be afraid to seek the care you deserve. Your body is speaking to you, make sure you're listening.